Good morning. Today we'll be talking about understanding asthma because it is the World Awareness Day for asthma. And we are very fortunate to have Dr. Sanusi here. Thank you, Dr. Sanusi, for coming onto the program again. We've caught you all the way from US of A. And so can you just quickly sort of start off for us? What is asthma and why do people need to know about it?
Okay, asthma is actually a disease of the lungs. A lot of times it's very common in families. A lot of people have it run in their families. It's hypersensitivity of the airways where children or adults can inhale something or they can end up with an infection that can cause narrowing of the airways. And what happens is there is respiratory distress where the child or the adult is having a hard time breathing. And sometimes if it's a bacterial or if it's a viral infection, it's something that happens very gradually. Viruses tend to cause it more than any other infectious agent, but allergies is also very common, especially in Nigeria from dust. Children inhale air that has a lot of dust and then they end up with asthma. Its presentation is usually very acute sometimes and children end up with respiratory distress. I tell parents, when you see a child breathing like they just ran a marathon and their ribs are going in and out, for smaller children, they're like really breathless, short of breath, they can hardly speak. That's an indication that a child is having difficulty breathing and they need to be seen as soon as possible. If they have inhalers at home, you want to go ahead and use it because there's bronchoconstriction of the smaller airways of the lungs, and that can increase the child's risk for having respiratory distress. In some very acute and unfortunate cases, we've had children that have actually died from asthma. And that should not be happening now in 2022, but we're still seeing that. So it's a problem.
Yes, now the World Asthma Day, the theme is closing the gap in asthma care. And as you're in a developed world, but you also work with us here in Nigeria in a developing world. So what are the kinds of gaps that you know about? What are the kind of gaps that exist in Nigeria that we need to close?
Well, a lot of children that we see in our practice in Lagos, we have a practice called Pediatric Partners. We do see a lot of children coming in and talking about, well, I'm always coughing and the cough is just not going away. And we see that they're being treated for pneumonia or bronchitis. Anytime you hear itis, that means inflammation. So if you're having bronchitis, that's actually an upper airway. It's more of a large airway inflammation. But when it's bronchiolitis, that's usually more associated with asthma. So I think the main thing is getting the correct diagnosis in the first place. A lot of children are underdiagnosed. If a child has been coughing for over a month and they're telling you that the cough is not going away, you need to suspect asthma, especially as a physician, but even as parents. And the shortfalls in Nigeria is that a lot of doctors, even when they get the diagnosis, they're not thinking about inhaled steroids because there's multiple ways of looking at asthma. You have two types of treatment. Just to keep it short, there's the rescue inhalers or the rescue medication, and then you have the controller medication. We're seeing a lot of children that are taking the inhalers, just the Ventolin, but they are not on the medication that's going to prevent a future episode of asthma, which are the controller medicines, and they are the inhaled steroids. I remember when I finished my residency in 1997, 1998, that became like a big deal here in America because before we were giving everybody inhaled steroids. In Nigeria, a lot of people are still using aminophylline. Nobody uses it anywhere else in the world but in Nigeria. So for any physician or clinician that's giving aminophylline, that's an outdated treatment. And if your child is sick and your doctor is offering you aminophylline, please run to a place where they're getting the correct diagnosis and treatment. So I see a lot of misinformation out there. We see a lot of missed treatment. So we can get the diagnosis correct, but if we don't know the treatment, and if we're not doing inhaled steroids, then the child is not getting the care that they need. And that's important.
That's very important, understanding and knowing the treatment. And again, is the medication actually available? Because when you talk about
Yes.
inhaled steroids, the inhaled steroids that they need, the nebulizers they need, etc., are they readily available here in Nigeria?
They are available. The big companies in Nigeria, like SmithKline, they do sell the inhaled steroids. So there's the fluticasone, which is one of the inhaled steroids that we use commonly. And then there's the Beclovent, but there's a lot of different inhaled steroids. If you talk to a pharmacist, they'll be able to tell you which one is available in Nigeria. And most doctors can actually find out for you. So wherever you go, if you tell them that you want inhaled steroids for your child, most times then they'll be able to get it for you, but it's available in Nigeria. And we do have a lot of our patients on it, especially after they're diagnosed with asthma, just to prevent future episodes. And
no,
that's controller medication, and it's the standard of care anywhere in the world.
So the two issues, one is to rescue and the other one is to control.
Absolutely.
Now, what are the other factors that need to be controlled? I know you mentioned some of the trigger factors that perhaps people could avoid. I don't know if you can talk a bit about what are the things that trigger an asthma attack. You mentioned some of them earlier. And is there any way that people can avoid them to prevent those attacks from happening?
Well, I think knowledge is power. The common triggers for asthma that we see are usually colds. So if a child has a cold, there's a lot of viruses out there that could cause an asthma attack. So really, you can't do anything about having a cold apart from wearing your mask and preventing infection by not staying too close to people who are sick. But the other triggers, especially in Nigeria, is dust. So sometimes dust mites can hide in carpets. So we usually recommend, you can't do anything about the outdoors, but you can do something about indoors. So we usually recommend if you have carpets in your room or in your home, try and change it to tile or hardwood floors where you can clean and minimize the dust. A lot of children end up inhaling dust from mosquito nets in the house. So if you can clean up your mosquito nets and especially on the windows, that helps. Your fans, you're putting on a fan, there's dust in it, your air conditioners, have them do the filters, clean the filters at least every month, just to minimize dust in the home environment. Now, when you're going outdoors, there's not a whole lot you can do, especially with generator fumes. When you put on your generator and it's producing all that fumes, those can actually be triggers for asthma. So that's why you want to always have your asthma inhaler there, which is the beta-2 agonist or your albuterol. That's the trade name in Nigeria. It's called salbutamol. So you want to have your medications there, your rescue inhalers. But if you're highly asthmatic, you want to also have your inhaled steroids. Now, there are three classes of asthma. You can have the mild, intermittent or persistent. You can have the moderate, usually it's intermittent, and then there's severe. So if you're mild, it means that you're having your asthma episodes maybe once or twice a year. And then once the cough goes away, you're fine. You have a cold, you have wheezing, and then you get better. But if you're mild persistent, that means like every other month or every month you're always coughing, wheezing, needing your inhaler. If you're moderate or severe, we usually recommend that you're on inhaled steroids all through the year if you have to be, because it's better to prevent future episodes of asthma than to end up getting it and then you can't function properly. You can't go out because you're always wheezing. Those are the children that we recommend should be on inhaled steroids.
Now, I think that's that understanding of how inhaled steroids are different from, oral steroids, because a lot of people still have that misunderstanding. They say, don't avoid steroids, it has side effects. So what's the difference? Why are inhaled steroids so widely used and so widely accepted now, as opposed to before when people were on, oral or even injectable steroids?
Right. Well, when you think about this, steroids, what do steroids do? They're anti-inflammatory. They actually help to suppress the inflammation in the lungs. But if you're giving an inhaled steroid, it stays in the lungs and it acts in the lungs and decreases your inflammation in the lungs. That's where the asthma happens. Now, when you're giving an oral steroid, that suppresses, it has a tendency, especially if you're doing the steroids for more than 5 days, that has a tendency to suppress the adrenal axis. And it can also suppress your immune system, especially if you're doing it for 20, 21 days and up. Now in pediatrics, we only give the oral steroids when we have really severe cases of asthma and when children come in with acute asthma flare-ups. And we give the steroids just for maximum 5 days. Some we give 2 days, depending on which oral steroid we're using. But when you give an inhaled steroid, the side effects of adrenal suppression doesn't happen because it stays in the lungs and it doesn't get into the system, doesn't get into the blood. So we usually try not to give oral steroids more than 5 days per month. So if, for instance, a child is coming in on the 1st of April with an asthma flare-up and we gave the oral steroids and then we said, okay, progressively get onto the inhaled steroids, that minimizes the inflammation in the lungs. If they come in 2 weeks or in 3 weeks' time, we try not to put them again on oral steroids until it's been at least 4 weeks. Steroids also for growing bones, it actually stunts the growth of children if you're doing the oral steroids. We don't see all that with inhaled steroids. And that's why most people, most doctors, physicians, especially in the US, we usually prefer to do the oral, the inhaled steroids, not the oral.
Yeah, now we have Yewande. Yewande to come in quickly and just tell us why, why did you set up the foundation, and also, what have you done in your foundation to try and close the gap in asthma care?
Okay, thank you very much. So my name is Yewande Sheu, and I'm the founder of Just Breathe Asthma Foundation. So Just Breathe Asthma Foundation is a safe place where asthmatics can come and share exactly how they feel with other people who they know, understand how they feel. And so I started it in September 2018, 18th of September 2020. And that was because I found out that asthma was not giving much awareness, especially in this part of the world. And also during COVID, a lot of people were panicked about COVID and their health because we were told that COVID affects the lungs and people who had respiratory issues were more prone to it. And I myself, I was really worried, and I saw how worried some other of my friends who were asthmatic were. So I decided to create a group chat, a WhatsApp group chat actually. And I was like, okay, the group will just be, okay, share how you're feeling today so that you don't feel like you're alone, because a lot of people don't know what asthma is. They feel like asthma is just more like everybody has asthma, everybody cannot breathe well at the point in time. And I created a group chat, and the number I got that day was very encouraging. And then after like a month, I was like, let me just do this the right way. And I registered it under the Corporate Affairs Commission. So now Just Breathe Asthma Foundation, the registered body. And we have over 254 people. So far, we've been able to provide asthmatics with inhalers and these portable nebulizers. I stumbled on it on Jumia, and I was able to provide, we're able to provide 5 people. Don't need electricity. So you can either plug it to the power. So that's also like a way of closing some of the gaps. And also last year, we went to a secondary school at Akoka. We went to some of the medical people from our team. We spoke on asthma to both the teachers and students. A lot of people don't know what it is. They mistake it for epilepsy, and that alone can even lead to the person's death faster. So that was all we've been able to do so far.
That's wonderful. Thank you very much. Now, what the patient said was very interesting. She started off at the age of 18. Is that common? At what age does asthma start? Was she misdiagnosed or perhaps missed at an earlier stage?
She's probably had it longer than that. Many times they're coughing and having colds and congestion and go away. And they go to the doctor and it's like, oh, you have bronchitis. And they give antibiotics. When you are given antibiotics at least 3, you probably have asthma. So she probably has had the asthma for a while. It's impressive that she was able to start this group. But the most important thing is awareness, and parents need to ask you need to ask your doctors when you see them that could this be asthma? If your child is coughing more than a week or 2, most colds will start on average 7 to 10 days. It'll start, and then by 7 to 10 days, the children should be better. If your child has a cold that is still there after 7 days, they either have asthma, they have a sinus infection, or they, if it's getting, so 7 to 10 days is the minimum, or is the most important time frame for a cold to run its course. After 7 to 10 days, see your doctor and ask them if your child could have.
I think understanding that about asthma is getting even more common now with all the environmental factors and other things. And there's also, though, a certain issue. In Nigeria, for some reason, there's a stigma. The parents don't want to acknowledge it. I have seen parents, and you tell them, child has asthma. Oh, no, I don't know. We don't have that in my family, you know, and we reject it.
Right.
How do you do that? How do you deal with that? And because it has long-term implications.
I like to diagnose them with asthma before the age of 4. And the reason is, once you diagnose asthma, that means that that child will have it in their chart. So for instance, if they want to go to the armed forces, or they want to do anything that has to do with outdoor, they could be discriminated against. So any children, when they have wheezing, we call it reactive airway disease in the first 4 years. After the age of 4, or if they're very severe where they're having asthma, even with the treatment, and they're just consistently inhaled at the age of 4, so that they get treated properly. Now, after the age of 4, most children tend to get better. And it tends to, as the lungs are growing, because when babies are born, their lungs are not very mature yet. But as they get to be 1 or 2 years old, their alveoli are more clear. So by the time the child is full done, but if they keep wheezing and they keep having coughing and poorly controlled symptoms of asthma, then we have to give them the diagnosis so that they can get the care that they need, and so that this can be nipped in the bud. So that's one thing to know. And when there's a family history of asthma, a family member that has wheezed and has been diagnosed with asthma, they are more at risk to go from reactive airway disease in the first 2-3 years to asthma after the age of 4. So that's just an important thing to take note of.
Now, in Nigeria, where most people don't even know about asthma, actually, there was a play that was on some years ago where it was actually just shown that this child was just coughing and coughing. It was a house help, sweeping and coughing and almost died, coughing and being made to sweep. So this is something that is happening. It's happening around, but the level of awareness is still so low. So what can be done about it?
I think we might need to get some brand ambassadors and get the information out there on social media, and even do movies or plays or anything to get the information out. Now the world is a global village. People can Google, they can do they can get all kinds of information online. I think as physicians, we have our roles to play, but I think like our patient, Yewande has done a fabulous job, and we want to encourage people like Yewande to join her group and just make it a big, just get that information out there, and eventually people will catch on. We change the world one patient at a time, and strong work, Yewande. So proud of you.
Thank you, Yewande, and we hope that a lot of people will join your Just Breathe group. So unfortunately, the program has come to an end. It's very quick. We haven't been able to cover everything, but do you have any last words for our listeners?
Well, I just wanted to encourage all our listeners to look into just reading or updating their knowledge about asthma, especially if you have children with 3 things. If you have a child that is persistently coughing, especially with a family history of asthma, or there's a triad that we look for: hypersensitivity, eczema, hay fever, asthma. Those 3 go together. So if you have a child who has bad eczema, always itching, scaly, dry skin, and coughing, or you have any of your children coughing, or with any of these 3 things, have asthma at the back of your mind, because your 1 or 2 or 3 of your children, or all your children, might at one time or the other be wheezing, and they might need an inhaler, either a controller or rescue medication. So keep that at the back of your mind. And then there's something called exercise-induced asthma, where children are running and then they get short of breath. They can't keep up because they get so short of breath. Those children need the rescue inhaler, usually the salmeterol, and they need to use it 30 minutes before exercise so that they can do what they need to do without their lungs closing up. That's another trigger for asthma. So just FYI.
Okay. Thank you so much for sharing. Thank you, Yewande, for coming on the program, and keep up the good work.
Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.